Hello and welcome to our sixth installment of the regional report out call here for Southeast Kansas. It is January 19th, and we're really glad to have you with us. We're here at 4:30 live on this YouTube channel every Tuesday, or I really encourage you to sign up at our website, which is covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. Megan, if you can make me the presenter, I'll show everybody just a little bit of what that website looks like real quick. And then what we'll do is we'll go through our normal routine here. We'll also show the dashboard, walk through that. We'll kick it over to Destiny for public health, over to Brian for hospitals. We have Dr. Watson also to talk about transfer situation, give us an update on that from the Mission Control app. And then we have Paul Harrison, a deputy director from KDHE, to talk about testing strategy. So we got an action-packed call here for you. And we're glad to bring it. So let me start by sharing my screen here. So you'll see this is what that website looks at like when you go in. Just put in your email address and you click on Southeast Kansas, subscribe, and you'll get an email as soon as this call is over with a link to the call, link to the dashboard, any other pertinent information. If you ever want to go back and look at what was going on in past calls, we have all of them right here archived on the page for you. So feel free. I really encourage you to sign up so you can stay on top of what's going on with COVID. And as we have vaccine news to share, we'll do that too. Here's the dashboard that our friends at the Kansas Hospital Association so graciously put together for us. Generally pretty good news across the state. Let's look at what's going on in Southeast Kansas. I have the numbers from last week here as a comparison. So right here, let's start with staffing. As you'll remember, we've talked about when hospitals have pinch points, it's around staff, stuff, or space. It's generally been around staff the last couple months. Of the 11 hospitals reporting, only 2 saying they're having staffing shortages. Obviously, it's better when that number is 0, but we're grateful that it is improving from where we've seen it. When we look at the total confirmed or suspected COVID patients hospitalized in this region, last week we were at 55. This week we're at 51, which is good. Unfortunately, from suspected COVID patients, we've gone from 13 last week to 17, which you might imagine is taking up more of the ICU capacity. We went from 13 last week to 8 beds available this week in the ICU for the region, taking us from 41% to 25% capacity. But when you come down here to the weekly case numbers, we really saw, a lot of the rest of the state was peaking right here, came into Southeast Kansas where we're having this peak later, which has been drawing a lot of concern for us. December, January, we're also now about 4 weeks out from Christmas. And we're really grateful to see the last 3 weeks, the case count go from 1,500 to 1,250 down to 900 this last week. And we want to continue to see this trend here in Southeast Kansas. So good mitigation efforts. And let's keep leaning in. Real important to try and bring those numbers back down to over here. Seeing some success in Western Kansas where they were able to see a hump like this and bring it back down. You can see in Southeast Kansas, the percent of the population of each county that has tested positive for COVID. And then what the ICU census is, well over half is COVID patients, or well over half is COVID patients, 53%. Then you have 7 non-COVID and 8 open beds is what it looks like. While I have the screen up, I want to show one other website here. We talked about this last week. It's kansasvaccine.gov. You'll remember vaccine has 2 C's, kansasvaccine.gov. And when you come over and you click on vaccine data here, it pulls up a dashboard, which I think will be fascinating to watch in the weeks to come. It talks about people vaccinated. This lags just a little bit with the data as it's entered. I think we're over 125,000 now at this point. But you can see first dose and second dose, the vaccines as they're coming into the state, the percent of the state that's been vaccinated, percent that's Pfizer versus Moderna. And then you can see the daily counts, and you can see the rhythm to, as the vaccine comes into the state, we get it out into arms. And then we wait for the next shipment. We get it out into arms, wait for the next shipment, and so on. And so we'll be watching it come across the state here with high hopes that in the next week we'll be moving from group 1 to group 2, or stage 1 to stage 2. Stage 1 being all of our frontline workers, healthcare workers, and long-term care facilities. And so just thought you guys would find that interesting since it was talked about last week. Again, that's kansasvaccine.gov. All right, let me come back to our friends here, and let's kick it over to Destiny Wheeler, the pride of Fredonia, Kansas. So Destiny, give us an update from Public Health.
All right. I am Destiny Wheeler. I'm from the Wilson County Health Department. And as John alluded to, we are at a frenzy and then a wait kind of a situation here. We get vaccine and we get it in arms as soon as we can, and then we wait. Most of the counties that I've spoken to in Southeast Kansas have been notified that we are getting another allotment this week. So that's exciting. We still don't know on the hospital side what they're going to be getting or when they're going to be getting it. So we have, many of us in the region have formed kind of vaccine coalition planning groups to help us to best distribute that, not distribute, but best administer that vaccine within the phase 2, how to prioritize and how much vaccine should go to what percentage wise. I know that's happened in several counties here throughout the state, but specifically Southeast Kansas. We are all really, really excited about that. To get vaccine in arms really is the goal, and what'll, I think, gives us that light at the end of the tunnel. I was really excited for the dashboard to come out this week because I wanted to see how our trend went. Our trend in our county is way down. We are seeing numbers lower than we saw the first couple of weeks of October. So I think some of the bigger counties are having a little bit more trouble, and some of the border counties have a little bit more trouble keeping their numbers down. One thing that I thought was interesting that happened, it was at a meeting last Friday. I was speaking with Crawford County, which is Pittsburgh, and we, on this call last week, we specifically talked about the percent positivity cases in Crawford County. And I wanted to note that I had spoken with them, and we wondered if it was the college, pushing the numbers up. And they said no, it was mainly families. So we're thinking that was a little bit of fallout from the holidays, more than the school driving that. So I thought that was interesting, just to note that. But like I say, right now we're waiting on vaccine and we're excited to get it in arms. And that's pretty much what public health is doing right now.
That's great. Destiny, thanks for that update. And just as a reminder to our viewers how this works. So the state will make a decision, like I said, hopefully in the next week, to move from phase 1 to phase 2. And once they open up that, then we move into what is a larger population. So phase 2 hits a lot more people than what phase 1 did. And how quickly we can move through phase 2 is largely going to be determined on how fast that vaccine can be produced and shipped to Kansas, our allotment from the federal government. And probably at first it's going to feel like more of a drip than when we wish we could get a fire hose. And so people just have to be prepared for that. Now, the other thing that will happen, the state makes the decision to move to phase 2. Each county will make the decision of how to move through phase 2. And so when Destiny's talking about these cooperatives and the groups working together, I really want to encourage our listeners to pay attention to their local county health department, who they're waiting for a little more information from the state right now. And as they get that information, they'll put out to you where you sign up, how you get in contact, how you get in line, what that looks like for your county. Your county health department will be driving this the next leg once the state moves from phase 1 to phase 2. So great people like Destiny and all that, be paying close attention to what they have to say this week. They're your guide to get through phase 2. Would that be right, Destiny?
Absolutely, yeah. And we are really, 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 I think all of us working hard to make sure we get the most exposed and most vulnerable people vaccinated first.
Absolutely. I think most counties would be starting with over 65 and going from there. we'll wait to hear. But hopefully we'll be moving phases, and hopefully we'll have more vaccine news to share on this call next week. So thank you, Destiny. Now I want to welcome back Brian Williams from Labette County to give us a little bit of a hospital perspective, and I can put up that slide for you. Whenever you're ready, Brian, to reference that, and we can go from there. So,
sure. Thanks for having me back. Again, I'm Brian Williams with Labette Health. We're headquartered in Parsons, Kansas, and we're really kind of central in Southeast Kansas. I think we look at a couple of factors. The things that we're looking at the most is ICU beds. So I look at our census today. We have 5 ICU beds, 4 are occupied, and one of those is a positive COVID patient. Good news, nobody on a ventilator. Today in our census, on our med surg floor, we have 14 beds. So to put it in perspective, right now we have 15 patients, which means we've doubled some rooms up, and we have more patients on that floor than we have normal beds. 3 of those patients are COVID. And I think what all the hospitals would say is, a typical average length of stay is a couple of days for most patients in a hospital. And the average length of stay has really been skewed on COVID patients, and they can be anywhere from 10 to 20 days. The level of intensity that requires for nursing care and respiratory therapy is probably exponential again. It takes, you may be in the room 30 or 40 minutes once you don all the personal protective equipment in there before you can come back out. And so you may have multiple patients you need to take care of. So it's really not only labor intensive, it's just time intensive and resource intensive. The other thing that we really look at a lot is for symptomatic patients, we've made every effort to try to keep symptomatic patients out of the clinics, out of the hospital. And so we have a fever clinic in Independence, and we have a fever clinic in Parsons. So what we ask is you make an appointment and we will test you. A couple of weeks ago, John, following your graph, when I went outside at 6 o'clock at night when I'd leave, it looked like Field of Dreams, just long lines of cars and people waiting to be swabbed. And so you can see that spike. This is around January 9th, but you can see the spike in the testing. And then you could see kind of the positivity rate. We had as high as a 38% positivity rate, that bottom red line above on that graph. But the interesting thing is it really correlates well. See the bend in the blue? So testing's coming down, positivity in the red's bending down, and that correlates really with KHA's reporting in Southeast Kansas. So looking at our census today, talking to our staff, I wasn't able to be on our Southeast Kansas call today, but I think in talking to Girard Medical and Freeman today, I think all the hospitals are experiencing a little similar respite, but everybody's holding their breath, and we're pretty guarded because as we were talking about this morning, there were 5 patients in the ER all waiting COVID testing. So it really, I think Destiny said, it kind of ebbs and flows. As far as testing, I might comment on vaccination. KDHE, I think, has done a really good job. Secretary Mormon was on a call with Kansas Hospital Association this morning at 10 a.m. And I think everybody wants to help. Traditionally in our emergency management and emergency preparedness plans, it's really the role of the county health departments to be kind of the front leader of setting up remote vaccination clinics and those things. But I don't know that anybody really anticipated the length of this pandemic and the intensity it would require. So, I think all the hospitals want to help. And I think each geography will vary. We've administered 727 vaccines. We have 30 doses left. We received notification today that our second dose of Moderna will be here next week. So I really think KDHE has done a good job. I really appreciate the flexibility that Secretary Norman's provided to the hospitals, because I think the most important thing is that we not waste any vaccine. So one of the challenges in this vaccine administration that everybody really needs to be aware of and patient of, takes a lot of coordination, a lot of planning. Once we stick a needle in a vial, the 6 hours starts. And so if we don't have 10 people standing there to get 10 doses of the Moderna vaccine, the last thing we want to do at 6 o'clock at night when we can't find any more healthcare workers is to waste two doses. So we've made every effort to not waste vaccine. And I know that's true at University of Kansas. I know it's true at Ascension. I know it's true at Stormontville and all the hospitals I've talked to. Kansas has 5 phases. You can see what other states are doing. Secretary Norman on the call today said he anticipated the governor would release this week when we'd be moving into phase 2. One of the recommendations the hospitals have made to Secretary Norman and the governor is to make it simple. It gets really hard, I think, for healthcare providers to say one comorbidity is more important than another. So that, is obesity more important than COPD or diabetes? So one recommendation we've made is just pick something we all know, age. And age is the highest correlation to death, to morbidity. And so 65 plus, let's get people vaccinated as quickly as we can in all our counties, 65 plus. So I think the secretary is considering that, and the governor, but we're all optimistic. And like you said, I think we're optimistic and we're ready to go, but it's going to come in starts and fits, and we're going to get vaccine. We're going to give it out, and then, it's going to slow back down. So everybody that's watching, really try to be patient. Know that the federally qualified Community Health Center of Southeast Kansas, Krista Postai, we talk weekly. I know they're talking to the county health departments, and the hospitals are trying to help. So we all want to collaborate and do the right thing for Southeast Kansans. That's kind of my update. And I think, for people watching, just these aren't normal times. We're asking a lot of people to do things extraordinary and be patient with hospitals. Your experience probably isn't going to be normal because the conditions really aren't normal. And we just appreciate your patience.
Thank you, Brian. Destiny, Brian, great updates. Very helpful. Let me pass it over to Dr. Watson here, who could just give us an update on the transfer situation. Great to have you back, Dr. Watson. Cheyenne Mountain Software and the Mission Control app. So, Dr. Watson.
Great, thanks, John. Really appreciate it. Yeah, and I think across the state, we're seeing very similar things. And I want to show you the capacity issues that we're talking about. Usually this is red on red, and we're at least seeing yellow and some green, meaning that there is capacity in the system across the state. The central part of the state, the Wichita metro area as a receiver, slower to open up. The Kansas City region seems to be opening a little bit faster. So I do think there was a lot of concern about Southeast Kansas and what was happening there. I think a couple things that I want to point out here is that not only are there fewer patients, but the ones that are there are actually sicker than they have been before. And I think that's where if there's concern left in the system, it's that with monoclonal antibodies, some of the other things that we've done to keep some of the less sick patients out of the hospital, we're seeing a number that are more sick. So overall, numbers better across the board, and certainly the last week, a big change. And I think that's where we're hopeful the trajectory stays the same. So
that's great. Thanks, Dr. Watson. And I know, a big part of this is we got really a race going on between how fast we can get the vaccine in arms before the more contagious variant, though we haven't spotted it in Kansas yet. Most scientists would believe it's probably here. We're testing for it, before that would become the dominant variant. So we got great people coordinating, doing everything they can to get it out there. But but while we're in that race, it's important to keep testing and keep the mitigation efforts. And that's why we wanted to have Paul on here with us from KDHE to talk about what they're doing from a testing perspective as they continue to adapt and make things better. So Paul, appreciate you being here. Go for it.
All right. Hey, hello, everyone. Thanks for having me. My name is Paul Harrison. I'm the Deputy Director at Kansas Health and Environmental Laboratories. I just wanted to come on here and give everyone an update of what the state is doing for the testing strategy, kind of where we've been and where we're going. The discussion about the variant is a nice little segue. Maybe I'll just lead with that. Here at KHEL, we can do whole genome sequencing. If you know of anyone who thinks they is a prime suspect for that variant, you can contact us and send us a sample, and we will sequence that for you. We're upping our capacity, our sequencing capacity here at the lab, and we're looking to go do even more. Yeah, that's definitely on our radar. All right, so let me get started here. The state of Kansas, since the pandemic has started, there's been over 2 million tests performed to date, and that includes over 1 million Kansans. It's quite an accomplishment, I think. So I want to make sure I give credit where credit's due. Besides the state lab, we have 9 contracted lab partners that we've been working with to increase this testing capability, the capacity in the state of Kansas. Everyone's done a really great job. What we want to do is continue to keep testing Kansans so we can reduce the spread, even as the vaccine rolls out. We need to make sure that we're identifying cases and outbreaks so that we know where we need to go, where we need to put resources, so that we can still control this pandemic, as the vaccine has this kind of slow rollout situation, which of course is bottlenecked by production. And we also, one of our goals is to return people to work and school. That's always in our mind. So we've reached out to a lot of K through 12 across the state, trying to figure out how we can support them, what their kind of testing needs are. We have a process for private businesses to apply to get testing performed in their staff to make sure that we can test them, make sure we're not putting people who may be positive into a congregate setting where they can easily spread that to others. This is one of the many ways we're trying to address this pandemic. We've also put up multiple testing sites across the state. So I'm sure everyone has heard of gogettested.com by this point. That's ran by a company called Well Health, and they set up these kind of mass collection sites across the state. And you can either make an appointment on that website to get tested, or you can just show up to one of the locations. And it's of course free testing for all Kansans. But what I really like to draw people's attention to are kind of the red and yellow dots on this map. The red dots are what we call community testing partners. And we've been trying to reach out to local pharmacies, like smaller pharmacies, FQHCs, community hospitals, anyone who really has the capability and the desire to want to do testing. So they would collect specimens and then send them to one of these contracted labs or to KHEL, and we run the tests for them. So that's been kind of instrumental, especially in areas of the state where it's not as densely populated. It's kind of easier if you find a small mom and pop's pharmacy that's willing to do something like this. It gives us another place for the public to go in these kind of smaller communities. And it makes us more agile, makes us more flexible in how we kind of attack this pandemic from a testing point of view. So what we're going to do moving forward is we're trying to expand that CTP program, that community testing partner program, and partner with these local. We know that there's not one size fits all in the state of Kansas. So we have PCR testing, of course. We have antigen tests that we can give out to help with testing across the state. We are trying to partner with some faith-based organizations to set up testing sites, collection sites, like on another facility to help drive that up. We have created mobile testing vans that we can deploy out to different areas of the state, to address outbreaks. And we've also partnered with a lab that has these mail-in saliva kits. So we kind of set them in a health department or one of these testing locations. Someone can come in, spit into that cup, and then it just gets mailed directly back to the lab. We've gotten a lot of great feedback on that program so far, so we're looking to increase it. When we brought out a lot of these big mass testing collection centers, we had some issues with turnaround time in the beginning, and we've been working really hard to solve that, and we're seeing that come to fruition right now. What we've done is we've moved the lab that was being used by some of these big vendors that were out of state, and we moved them to integrate with local Kansas laboratories. So you don't have the travel time to get to the lab anymore. That's significantly reduced. And the Kansas labs, if I can go ahead and give them a big pat on the back, they are fantastic. And they have some great turnaround times. We're seeing about 24 hours for most all of them. You can always get a test done, but if you don't have the result within a certain time frame, what good is that going to do you? And so that's a huge component of this, is make sure we get the results and get them back quickly, so that the epidemiologists and the health departments and everyone can do their job and can really control this pandemic. And then, of course, like I said before, we have rapid antigen tests that we have gotten more access to, been able to acquire some more of those. And so we're looking to expand where we put those across the state as well. All right, so moving forward here, we want to partner with someone in your community. So if you know of anyone who would like to be one of these community testing partners, please get them in touch with us. We feel, especially for these less densely populated areas of Kansas, it's going to be a huge driving factor to keep increasing that testing. Be our eyes and ears in the ground. Give us any kind of feedback that you can think of. If you think we're kind of not addressing it the right way, you have an idea for what's going to work in your community, let us know, and we'd be glad to listen and develop something with you. We are here to help all Kansans. And of course, encourage to keep testing and vaccinate. That's a huge one. And I know I don't do as much of the vaccines, but that one's so important. That's key. Guess it goes without saying. So if you do need to contact us, you need any help with anything, here's a couple of places to go to. There is a general COVID call center that KDHE has set up that you can reach out to. You can always get to your local health department. They know how to get a hold of us as well. If it's anything that deals with the state lab, KHEL, here's the email address where you can send out to get any help. And if it's for one of the mass testing sites, one of those go get tested sites, this is the call-in number at the bottom here that you can use to call in with any issues you have, or if you're searching for anything, that's where you go.
Well, thank you very much. It's a great report out. Best mustache of any of the calls also. I just want to give you credit where credit's due. Anyway, Brian, Destiny, Doc Watson, anything you guys would want to add here before we wrap it up? You're muted, Brian.
Just, one thing in talking to patients, don't, just because you get the vaccine, first and second dose, please continue to social distance and wear your mask. It's not we get to lift all the restrictions. So.
Yeah, especially after that first dose, there's still people that are contracting it from. So thank you, Brian. That's good. And hopefully next week we'll have a little more information for you on vaccine. Brian, Destiny, appreciate all your work. Paul, Dr. Watson, thank you for the ways you're serving the state.
Yeah.
And we'll be back here 4:30 next Tuesday, give you an update on what's going on in Southeast Kansas. Feel free to sign up for the email. Just a bright spot real quick. We like doing and catching people doing something right. Just something viral. KSN here in Wichita ran a story. A gal named Amy Sharash had parents that had been in. She wanted to feed the COVID unit that helped care for her parents while they were dealing with COVID. Posted on Twitter. Another lady contacted her named Amber Tracy. Together, they've put a GoFundMe page together called Feed the Healthcare Heroes. They've branched outside of Wichita, and they're going around the state just getting snacks and meals for the people that are really on the front lines treating folks. So that's a GoFundMe page of Feed the Healthcare Heroes. I think it's really cool what they're doing. I love their quote here. I'll end with this. They keep telling us thank you. And we're like, no, all the thanks goes to you. You're the ones doing this. You're the ones saving families and saving lives and putting your life at risk to do these things. And so I love that spirit. We need to bring more gratitude into the world, not less. And I love seeing them show the gratitude of these people doing the hard work. So thank you all for being on the call today, and we'll see you next week.
Thanks, everybody.